Good morning and welcome everybody to the grand opening of our newest location at Achieve TMS Central here in Sioux City, Iowa. We're so thankful to have everybody joining us today. We have a really great crowd and a really great team. So the Siouxland Chamber is also here as our guests. We're going to go ahead and start right in with our opening remarks. I'm going to flip the camera around and start with Rebecca Curran. She is our regional operations manager. So, hang on one second. Okay, Becca.
Hello, my name is Rebecca Curran and I'm the regional operations manager for Achieve TMS Central. Thank you for being here with us today to celebrate the grand opening of Achieve TMS Central here in Sioux City, Iowa. We're very excited to offer deep TMS services to the Siouxland area. I'd like to thank the Sioux City Chamber of Commerce for their welcoming support of Achieve into this community. We really appreciate all your flexibility and adaptability during this interesting time that we're in. And I'd also like to take a minute to recognize Angie Harris, our regional marketing manager, who does so much behind the scenes to put all of this together.
Thank you.
And of course, I'd like to thank our leadership team for their ongoing support and guidance. I'd like to take a minute to introduce our team here in Sioux City. We have two technicians here in Sioux City, Tracy Winters.
Hello.
And Rachel Ray.
Hi.
Tracy and Rachel are both experienced caregivers and active in the community, and they're dedicated to bringing beneficial resources to people struggling with mental illness. And of course, our doctor, Dr. Nazreen Abuada. Dr. Abuada has worked and continues to work in a variety of settings in the Siouxland area, several of which serve high-needs populations. Dr. Abuada's holistic approach to patients and her dedication to quality patient care makes her an asset to our team. So we really have a fantastic team to deliver excellent quality care here.
Great.
Hi, so I'm Dr. Abuada, and my message is always that there is hope. There's always hope, especially during this time, because there's a lot of things going on and it's stressful. And it's especially when you're dealing with depression, it is hard to remember that. So that's something that I want everybody to remember. I want to welcome everybody who is here. Thank you for coming. And I have been in this community for several years, working with different people, and I have a deep commitment for service, for improving everybody's life and working together as a team. With our team here, when you come, it's a very relaxed environment, very comfortable for the patients. We'll be working with all the providers when you refer them to us. All of us are in this together. It's not just one provider or the other. The Deep Brain TMS is evidence-based, high-quality care. I'm very excited that it's coming to us because it's basically top-notch kind of treatment. And let's pass it back to Becca.
Thank you very much.
We've got a ribbon to cut here. Oh, is it time for this?
Yeah.
Sure, I'll hold the other end of that. And everybody behind us here.
Yeah, everybody behind us, and yeah.
Oops.
You can get more than
The
one
entire
here. You
crew.
can get another set.
Tracy, go ahead.
We're
Get.
gonna take that.
I can maybe do this if you want to get in on the picture. I can do this part of it.
You can put your hand on it as well, and your staff. Get a little
Who's
closer
in there?
so you can all
Get in
get a
there.
picture.
So you can get a picture.
Yay.
Nobody will know who you are.
Nope.
Okay, if you guys could look this way.
Can you take a couple pictures?
Super.
Okay, 3, 2, 1, cut.
Yay.
And we have a plaque to present you.
We have a plaque, official plaque from the Siouxland Chamber here, along with a sticker that you can place in the back there, anywhere public located for you.
Thank you very much.
Thank you.
You get the ribbon too.
All right.
All right.
No, not
That's good, Florence.
There you go. Absolutely.
When did you guys first open?
Right now, we just took possession of the office in the middle of November, and
Okay.
so we've been working on training.
Oh, way to
So,
go.
yeah.
Good ball.
Yeah. We are
When's your
rolling.
official first opening day then? When do you start accepting patients?
We already
Oh,
have
now,
things.
yep,
Yes,
yep,
yes.
mhm,
Oh,
yep,
Yep, we already
Perfect.
have things in the works.
yeah.
Wonderful.
Very
Yeah.
exciting.
And are you working with the other organizations then in town that serve mental health and?
Yep.
Yes,
absolutely.
yep.
Very
So
collaborative.
Jennifer is with Heartland Counseling.
Yes.
Oh, wonderful. Oh, good, great.
Okay. Actually, I was thinking about you guys this morning because I couldn't get in touch with Heartland because I didn't know who to contact.
Okay, I can, yep, I can set you up. Heartland is open, long hours Monday through Thursday, but on Fridays we close at noon. And we had training today, so, you might not have been able to reach us today, although because of telehealth, of course, as you know, we can see people kind of on the weekends and off hours too, which there are some perks to things, you know, changing.
Yeah.
So if we focus, like you said, on the hope and the positive end of those changes, that will help us all through this.
Definitely, definitely.
Okay.
All right, we're going to move over here for the demonstration, talking just a little bit more about what the presentation, about what TMS is and how it can help folks. So Becca's going to be talking over here. I'm going to probably focus mostly on the screen.
That's fine. Okay. So, Achieve TMS Central, we are a mission-driven organization dedicated to helping people that are suffering with major depression and OCD with deep transcranial magnetic stimulation. And we collaborate closely with community providers. Our clinical team strives to provide outstanding, high-quality care to give hope to our patients in a positive and supportive environment. The prevalence of treatment-resistant depression is quite a bit more than what you would expect. There's a high prevalence of depression in general. 1 out of 6 Americans will suffer a major depressive episode in their lifetime. That's about 15 million a year. Of those 15 million a year, 32% are resistant to any drug therapy. So that's about 2% of the adults in the U.S. population in any given year are considered to have treatment-resistant depression. This is a study that shows people who are resistant to their first line of medication treatment, their likelihood of achieving a response and remission with each successive medication trial decreases steadily. So what they have learned over the years is that a depressed brain is not functioning the same as a healthy brain. There are changes in blood flow, changes in circulation. Sorry, I clicked that on. And you can actually see this when you're doing scans of the brain. So in major depressive disorder, there are key areas that have been identified as being major players in this. And what they have found is that some of these areas are hypoactive and other areas are hyperactive. So TMS promotes the release of neurotransmitters. The area of the brain that we target is the left dorsolateral prefrontal cortex. So we're stimulating that area with the magnetic pulses, and this stimulates the other areas further down the chain too, and then sends the signal right back up. So you're stimulating the whole circuit. TMS is not as new as it seems like. It's new around here for sure, but it has been around for a while. Surface TMS has been FDA approved to treat depression since 2008. And the BrainsWay Deep TMS has had FDA approval to treat depression since 2013. So the two types of TMS are the deep TMS and the surface TMS. And the primary difference, other than the type of coil, is the depth of penetration. So with the surface TMS, you're penetrating about 2 to 3 centimeters. With the deep TMS, we're able to penetrate 4 to 6 centimeters, which allows us to stimulate those deeper structures in the brain, where those deeper structures have significantly more connections with the underlying mood circuits. And the deeper stimulation has been producing better treatment results. So this is just showing a comparison between deep TMS and surface TMS. And what we're seeing in the blue is the response, and the red is the remission rate. So in both categories, the deep TMS is showing a better response and remission rate than surface TMS. This is a study that they did in 2018 in Croatia between the surface TMS and the deep TMS, and a group that was strictly on medication. So after 4 weeks of treatment, and each group was only treated with just deep TMS, just surface TMS, or just medication. And what they found after 4 weeks of treatment was that with the deep TMS, we had a 72% response rate compared to a 44% response rate with surface TMS and only a 26% response rate with medication alone. And the remission rate after 4 weeks was 64% with deep TMS, 43% with surface TMS, and 12% with medication. So we're seeing significantly better results with the deep TMS treatment. And as they went on with studies, what they have learned, this is strictly with deep TMS, 20 sessions compared to 30 sessions with your remission and response rate. So with 20 sessions, you're getting a 42% remission and a 64% response rate, whereas with the 30 sessions, you're getting significantly higher, the 51% remission rate and a 75% response rate. So it's quite a bit better. The referral process for TMS is actually really easy. Providers can refer, the patients can self-refer too. TMS requires a prior authorization, so every patient that comes in, we screen them, we do our psychiatric evaluation, we gather all of the records, and then we go through the prior authorization process. So we're really making sure that the patients that we're bringing in are appropriate for deep TMS treatment. And then once they're approved, the cortical mapping and treatment begins immediately. So the treatment regimen, as I said, what they found with the 30 sessions as compared to the 20 sessions was a significantly higher response and remission rate. So our treatment regimen, we do 30 treatments, 5 days a week for 6 weeks, and then we do 6 treatments, 2 days a week over 3 weeks, kind of a tapering period. And the treatment itself only lasts 20 minutes, so your appointment lasts 30 minutes or so, depending on how chatty you are. It seems like people get chattier and chattier as it goes on, so sometimes the appointments get a little longer. The wonderful thing about TMS is there's no systemic side effects, no adverse effects on cognition. The complaints that are common are generally more towards the beginning when people are starting treatment, and that's headache, neck pain, and those are kind of short term, and of course minor fatigue. There is a low risk of seizures with TMS. There was no seizures during the clinical studies, and 6 seizures reported in the post-marketing period, so that's about a 0.1% rate, which is even lower than some medications actually. This is just a treatment comparison chart of side effects, and you can see with TMS we've got the headache and fatigue. With antidepressants, there's several systemic side effects. It can be a lot of things: memory loss, anxiety, dry mouth, digestive issues, lots of other issues that can come with it. And then of course with ECT, the memory loss, dry mouth, dizziness, anxiety, insomnia, hospitalization, all of those things. So significantly fewer side effects. There are contraindications to TMS. Any implanted magnetic metal in the head or the neck, pacemakers or implanted devices like cochlear implants and things like that, a history of seizures or epilepsy, and those can be reviewed case by case. Substance abuse that lowers your seizure threshold, and neurological conditions that increase seizure risk. Of course, severe dementia and pregnancy. TMS doesn't treat dementia, so when we're looking at patients like that, it's kind of a pros and cons, whether it's beneficial to them for the TMS. And pregnancy, there hasn't been any studies using deep TMS on pregnant women to, show the safety of it, so we just don't treat during pregnancy. Err on the side of caution. Insurance does cover TMS for the treatment of major depression. Insurance companies have their own standards for it. Some insurance companies have decreased it down to 2 medication failures, and they'll approve for TMS. Many of them are still 3 or 4. And we participate with the major insurance carriers in the area. And we do accept both Medicaid programs in Iowa, and they're actually really good at covering for patients. There are other indications for TMS. It's FDA approved to treat OCD. It is also now FDA approved to treat nicotine addiction.
Oh, interesting.
And they have ongoing studies on bipolar, and they actually have quite a few ongoing studies into different things that they can treat with deep TMS. So it's a very exciting field to be in. So why work with Achieve TMS Central? We use the groundbreaking technology to offer superior results. Our patients, they continue their current treatment with their existing providers. Our patients are in therapy, they're working with their medication providers. We're really collaborating with the providers to get that holistic treatment. We have ongoing communication. There's no waiting list for appointments. Our staff handles all the insurance aspect of it. We're all specially trained. We offer flexible hours to work around people's schedules. Some people like to come in before work or after work or on their lunch break, things like that. Everybody's got busy schedules, so we try to be very accommodating. And we actually have lots of staff here to make that very easy. And we make sure that our offices are all very accessible. And of course, we enforce the COVID-19 safety guidelines. Our treatments have always just been one-on-one, so really we built a little bit of extra time in the schedule for extra heavy-duty cleaning in between patients and things like that. And we manage appointments, so there's very little overlap, not a lot of people coming and going at the same time. There's plenty of time for cleaning and things like that. And we check temperatures, masks are provided. We're able to practice social distancing. And we continue to offer telehealth options with our psychiatrists and psychiatric nurse practitioners for evaluations and treatment follow-ups and things like that.
That's it. Yeah, great. Thank you.
Yeah,
Does anybody have any
absolutely.
questions? That's a lot to take in. Yeah, definitely. You did a great job. Thank you.
Yes.
Yes, definitely.
Absolutely. So we're going to go in the other room and I'll give you all an exam. So
Yeah.
we're going to do a brief demonstration. It's just going to be a really abbreviated demonstration kind of how we find the treatment location. Okay.
So,
And they're going to demonstrate on me.
go ahead.
I was gonna volunteer.
I know.
Could explain a lot.
I'm going to get back in the corner here.
I might have zoomed through that pretty fast.
No, that was great. Very helpful.
Yes. So I have to take my hair down. It'll be a big answer.
You'll be good.
Yes. So Tracy's one of our technicians, and she's going to put the cap on me. Every patient has their own cap, so there's never any shared caps, and the cap's always on. The machine's never on anybody's bare head. So.
This is a nice little fancy cap. Unfortunately, we're probably gonna mess up your hair.
That's okay. I didn't spend a lot of time on it.
And I want to put this right at the nasion, right in between the eyes there.
Yeah.
And get my chin.
Yeah.
In the back, so it's
And the Velcro is very good.
Yeah.
It's strong Velcro.
Yeah. And this cap is actually Becca's, so we have their names on it,
Okay.
so.
I'll just add that while a person is in treatment, we do have the ability to watch Netflix or programs or whatever. We give people earplugs, and oftentimes they just choose to watch a program instead. So it's a really nice, comfortable environment.
How long does the treatment last?
About 20 minutes from start to finish.
So you can do.
All right, so then I'm going to bring it up, and I'm going to put it at a level 7, just to shorten this. We would do a lot more levels, but we're just gonna, we know where Becca is.
Yes, they've mapped me a few times, so they're pretty familiar with me.
So I'm bringing it down.
So what normally happens if you're mapping someone?
So when we're mapping somebody, what we do, So you have a motor cortex in your brain that is,
Yeah, then you're gonna push it.
yes, that has, there's areas on your motor cortex that are specific to different parts of your body. So what we're looking for on the motor cortex is the area that stimulates your right hand and specifically your right thumb.
Oh.
And so they know me pretty well, so, and I get a pretty good reaction in my right hand at 7 level.
Ah. So in a normal situation,
Sorry,
they
I
would
probably
test
moved
all of these different levels to see which had the best response,
Yes.
and then that would be decided as the treatment placement of the helmet.
Very
interesting.
Yeah.
Yep, I can feel it.
All right. This is part of the mapping process to find out that threshold, but we're just gonna do a,
Yep, since they know me, just for the sake of saving time,
and we'll charge. There we go.
You're ready?
Yep, I'm ready.
And then Tracy counts.
3,
Yep.
2, 1.
So you can see the response in my right hand. Were you guys able to see it?
Yes.
Yeah.
So they know
Very
where my good
interesting.
response in my right hand is. So then from there, where we find the area on your motor cortex that's, we get the best response in your right hand and your right thumb, then we move to the treatment location from there. And so there's a formula that we use, and then of course we also adjust, you know, it's individualized. Everybody's head's shaped different, so, yep, it's unique to each patient.
So then we're gonna go down from the 7 to the treatment level, which is gonna be down here at 1. But we don't wanna go below the eyebrows, the eye.
Yep.
There. So we're gonna undo this, cause then we're gonna put another strap on.
And that way during the treatment I can wiggle
Yeah.
around, because
Mm-hmm.
I'm not very good at holding still.
All right, so we're gonna come down here. We're gonna keep this centered.
Yeah. Once you get like the treatment spot, the sweet spot, if you will, this part goes quite fast every single day that you come in for treatment.
Do they test that level each time though, to make sure they've got that, or do they just go right to where the treatment spot is?
We test it once a week.
We
Okay.
reassess the patient once a week. But
Unless there's something out of the ordinary, if somebody comes in and says, you know, I didn't sleep at all last night, I drank like 6 cups of coffee today rather than 3 cups of coffee, anything out of the ordinary, we would want to test that motor threshold to see how it's reacting.
And it's always okay to just be like, well, you know what, you didn't get any sleep, we can skip today and we'll just do it again, we'll
Still
carry
not
on
quite down to
tomorrow.
1,
Yep.
And they come daily?
But we're,
Yep.
5 days
we're
a week.
at the
Yep.
mark there.
Okay.
All right.
And then they're just gonna deliver a single series of pulses so that you can kind of hear it.
Then I'm gonna come back here. Oh, you already tightened it? Okay, good. And, okay.
Looks good?
Yep, looks good.
So we're gonna deliver the pulse then.
Yes.
You ready?
Yep, I'm ready.
Okay, do you, let's use that down to.
And then during this
80%.
part, my hand, it doesn't, it's not on your motor cortex anymore, so my hand won't.
Do you feel
Yeah, let's
anything
set it 80.
You can feel it, yes. It kind of feels like a blunt,
Okay.
like a tapping.
in your head?
Yeah, it feels like it's right on your head. Yep, I'm
Yeah.
ready. Go ahead.
All set, we're gonna deliver the,
Okay.
he's gonna charge first. Okay, we're gonna deliver the pulse.
And you can see it, you get a little bit of a muscle twitch from it.
Let me just stop it now.
No, one's
That's good.
So that's considered, yeah, that's considered a train. You would get 20 of those with a little pause in between for each treatment. So that's it. I mean, aside from a little bit of sound, and it just takes a little bit of getting used to sitting in the chair. It's pretty simple once you get into it.
Yeah.
I would say the first several times I was practiced on, what I noticed mostly was fatigue in my facial muscles, you know, because you're not used to those muscles twitching. But outside of that, I didn't really have any, I didn't have any headaches or anything like that. So.
That is fascinating.
Yeah,
Isn't that?
isn't it?
Yeah.
Yeah, yeah.
Anybody have questions? How are you?
I'm actually very happy. They've been practicing that.
Yeah. Well, and like she mentioned, one of the great things about it is that you can drive yourself. You can come before work, after work, on your lunch break, get it done, and go about your day. Unlike ECT, where you're sedated and you'd have to have somebody with you, this is really, I know it's a huge commitment as far as the amount of treatments in 5 days a week, but I would say it's non-invasive on your lifestyle too.
Yes.
So,
And especially since the whole course of treatment really is 9 weeks. So, and then you get lasting benefits from it.
mhm.
And a lot of people continue to see improvement 2 weeks and 2 months afterwards. So, yep.
So
absolutely.
one 9-week session usually will, along with med management and continued therapies, things like that, is that typical? They just do one 9-week treatment, or?
Yeah, I would say that's pretty common. There is, you can come back for booster treatments after 6 months.
Okay.
Yep. And then it's not necessarily, you don't have to do the whole treatment regimen over again.
But I do think it's important to note, like you said, it is not to eliminate your medication. We're considered an add-on. We don't want people to think that this is the end-all, be-all to your medication problems and woes. That's really with your medication prescriber. And Dr. Abuada obviously is very well-versed on the effects of what your current medications are and how that works with TMS. So she would review your medication list to make sure it is safe. And make recommendations from there. So definitely an add-on, lots of really good results, upwards in the 70% of people respond very well to treatment. So sometimes it's a matter of just your meds are decreased after a while. So a lot of people get those benefits from it, but again, it's up to the medication prescriber.
Yep, and of course we always try to communicate regularly with their prescribers too.
Yep.
So that we've got that good communication and that coordination of patient care.
Yeah.
Yeah, the way I think about depression, we need all sorts of modalities together. It's just that it's not one thing fits all. So
Right.
TMS gets a piece, the therapy gets a piece, the provider with their medications all working together instead of just one modality. Because if one modality worked, they wouldn't be doing TMS. They would have been responsive. And that's the whole idea behind TMS, that if somebody is failing 2 medications at least, it is time to, you want to call it adjunct or complementary, add something to make it work better.
Mhm.
So,
Absolutely. Yeah. Wonderful.
Are there cases where people are actually able to reduce their medications or get off some medications too?
Absolutely.
the nice thing about TMS is that you are stimulating different parts of the brain to grow, neuroplasticity. With the medications, we can't control that. We don't know what's going on. So hopefully with the neuroplasticity, you're creating different parts of the brain, stimulating different parts of the brain, and then you're looking at a different kind of brain after the treatment. So it's a very dynamic thing. It's not a, kind of a cookie cutter, off medication, on medication.
Yep.
It's we assess every few weeks, we meet with the patient, we work with the provider, take everything into account. So,
Yeah.
absolutely.
And it's just like with exercise where the more you do it, the better your results are. So for the first couple weeks, you might not realize that you are sleeping better or that your mood and your affect has improved, but people around you start to typically notice that a little bit sooner. And then towards the middle to end of treatment is when people usually start feeling the effects themselves, or at least being able to recognize them. Yeah, you bet. Any other questions? Anything else anybody wants to add? Good job, Tracy and Dr. Abuada and our little guinea pig.
We have some information here if you'd like to take some.
Yeah.
Material.
Yeah.
Awesome.
How about the referral process then? So how does that work? If somebody is seeing their therapist and they're seeing these, the 2 or 3 medications didn't work, and how does that process work?
So the referral process is actually really easy. You can refer right through our provider portal on our website, and you don't have to be a doctor per se to refer. Therapists can refer as well. Patients can also self-refer. They can submit an inquiry, and then we'll reach out to them directly, and then that's when we start communicating with the other providers and the therapists and people who are involved in their care, and we go from there to make sure that they're appropriate.
Yep. And I would say, I think one of the biggest things that we're doing, especially during COVID, is trying to up our social media presence. So we're on Facebook, we're on Instagram, we're on Twitter, and we have videos on YouTube. But whatever we can do, because it's so limited for spreading the word, like physically within providers, to spread the word in whatever way that we can, is certainly appreciated, and we'll take any good recommendations or word of advice from anybody. All right. Well, I'm going to say that's a wrap. Great job, everybody. Thank you.